Good afternoon, and thank you for joining us. My name is Sonia Crosby, and I'm with the Division of Professional Studies at UMBC. Welcome to the UMBC Health Information Technology Virtual Information Session. Today's webinar will be presented by Dr. Crystal Harian, Director of UMBC's Graduate Health IT Program. I will now hand the presentation over to Dr. Harian.
So thank you so much for the introduction, Sonia. I appreciate it. Hi, this is me. I'm Crystal Harian, and I am the Graduate Program Director of the Master's in Professional Studies in Health Information Technology here at UMBC. And today, some of the things that we're going to be going over is a little bit about the program and our faculty. I'm going to go over a little bit about the health IT field, specifically why health IT at UMBC is regionally so well situated in the job market. I'm going to talk about some of the requirements for the MPS degree, and then go through a little bit about UMBC Graduate School policies and designations, a little bit about the application process. We are currently still accepting both domestic and international applicants. And then we'll have time for some questions and answers, but you can always feel free to reach me by email if a question occurs to you after the webinar, either about the program or about health IT in general. And so I like this quote: the best way to predict the future is to create it. And I congratulate each of you for considering this master's program as a future step towards a very successful career. And so UMBC is regionally located close to DC, close to Baltimore in Catonsville, Maryland. It's been rated the #1 up-and-coming university for 5 years running, and up-and-coming schools like UMBC are making the most promising and innovative changes in the areas of academic, faculty, and student life. UMBC has also been named the top national university for promising and innovative changes, and you'll see those both as part of our HIT curriculum, but also as part of the university, the broad university as well. We encourage a lot of interaction between our faculty and our students, and I think that the students will really appreciate the high quality, innovative faculty that we have here. So UMBC is an honors university. We provide the resources that our students need to succeed. We encourage a culture of interaction between our faculty and staff, and that includes both inside and outside the classroom. UMBC is one of the most diverse universities in the US. We have a high proportion of both domestic and international students. We're recognized for our research and technology programs. UMBC is actually one of only 2 state universities in Maryland that have the designation of high research honors, as we have been recognized at the state level for our high quality research programs. And I'm really proud of our robust campus resources. Some of the things that you'll be able to take advantage of here are our writing center, which will help you doing some of the case studies if you need it. For some of our students, they utilize the English Language Institute here, which has a lot of complementary courses available for our English as a second language students, both in writing and improving public speaking skills. As a UMBC graduate student, you'll also have access to the athletic center, including indoors and outdoor pools, the library, which has 24-hour study spaces, and also one resource that I utilize here is our faculty development center, and they're constantly looking at our curriculum, at our teaching methodologies, and really helping me to come up with new innovative ways to constantly strive to improve on our curriculum and the engagement of our students. And so a little bit about me and my background. I actually graduated from UMBC with a BS in Biological Sciences, and then I went to Johns Hopkins where I did neurological sciences research, and I got a master's in biotechnology. I went to medical school at the University of Maryland, and after graduating, I specialized in biomedical informatics, including completing a postdoctoral fellowship at NIH in biomedical informatics. After that, I worked briefly in Congress on the healthcare reform. And then I went to Columbia University in New York City, where I specialized. Some of my research areas included pharmacovigilance, natural language processing, public health informatics, drug repurposing. And as a student, if you're not familiar with some of these research areas, they're certainly something that you'll learn more about as part of our curriculum. And you'll also have the opportunity, if you're interested in pursuing this type of research work, you'll have the opportunity to do so. After I finished at Columbia, I moved back to Maryland and I worked at the U.S. Food and Drug Administration in the Center for Tobacco Products, where I looked at ways to improve the public health and decrease the many deaths that we see from the use of tobacco products. And there I also did some back-end data mining on some confidential documents that are there in-house. And I know that the FDA really is seeking more specialists in this area, more specialists in the area of health IT. And you'll have the opportunity through our program to develop kind of the soft skills and a breadth understanding of the field, but also some of the technical skills that you really need to succeed in careers such as those at the FDA. And so a little bit about our faculty. I think one of the advantages of this program is really that our instructors are prominent in the health IT industry, in academia, and in government fields. So depending on your interest level, you can match up with a good faculty member that will help mentor you into either industry, academia, government, or even the startup entrepreneurship space. We also have faculty members that teach in our program that are part of the UMBC Information Systems department here. And I know in the past we've had some students that express interest in incorporating some of the IS courses into their elective curriculum. And we can talk more if you're interested about the ability to do so. A lot of our faculty members do conduct research in this field, including on campus we have a health IT lab where research is supported by the Department of Health and Human Services, and that research is focused in the area of home health care and hospice, and also health IT supported healthcare quality and management improvement. We're also partnered with the Baltimore Veterans Affairs Hospital, and utilizing their clinical data warehouse, we also have faculty members that are doing things such as developing predictive models of things such as suicidal ideation or suicidal admission. And the thought there is that hopefully through utilizing these large data warehouses, we'll be able to make changes to the healthcare system to prevent these things or to detect them at an earlier time point. Again, part of our strength is that our faculty have real-world experience, and so some of our faculty actually work full-time during the day and then teach in the evening. And they work places such as the Maryland State Government, AHRQ, NIH, and if you're not familiar, these are government agencies here in the U.S. that conduct some health IT and quality research. They also work in consulting companies, and they play leadership roles in the Maryland State Health Information Exchange. And so when we look at why the health IT field, it really is an innovative field, and it gives you the opportunity to better human health and potentially cut costs. And so the U.S. government has done a lot recently to address these exponential healthcare costs, and a lot of what's being done in the field is looking at ways to both reduce redundancies that happen in the healthcare system and to improve the quality of care. And you'll learn a lot more about this in the program. And so the American Recovery and Reinvestment Act, including HITECH, which is the Health Information Technology for Economic and Clinical Health, was put through, and the U.S. government has spent close to $52 billion on instituting electronic health records and improving the communication between some of these records. And this has been done through incentives through the Centers for Medicare and Medicaid. And the overarching principle behind this was to increase record adoption, like electronic health record adoption. This was done as a way to introduce technological innovations that might help to reduce some of the exponential healthcare costs in the US. And the elective coursework in the health IT curriculum that you will be able to participate in will be things such as utilizing big data, mobile computing, cloud computing, and social network. You'll learn about social networking and other things that may potentially be utilized to meet the needs in this changing landscape. And so for health IT, it's a dynamic, rapidly evolving field, and government's looking for return on their billions in investment. So you can tell that it's an area of high expectations, both politically and from the public. But in the program, you'll learn that leveraging healthcare information technology is not always so straightforward. There are complex workflows and data models. Just initiating an electronic health record in a hospital system might not be enough because there are other workflows that you have to take into consideration, such as the clinician's use of these systems. There's also difficulty with demonstrating the usefulness and the ease of use. And so through the program, you'll learn different quantitative and qualitative methodologies that you can use to study and ask the questions if whether or not implementation of this technology has really been effective. I think this is really a dynamic field. There's a continuous stream of changes, and it really takes somebody that's motivated to learn more about managing them. And there's high economic stakes, but there's also lack of agreement among stakeholders about best practices such as health information exchanges. And this tends to be not a technical problem at its core, but you'll learn in the program both the technical aspects of things such as the health information exchanges, but also some of the human factors behind coming to agreements between potentially a community health center and a hospital, and how do they come to agreement about the type of patient information that they're able to securely exchange. And so at its core, health IT adoption success relies on an understanding of these various aspects: the people, the organization, the technology, and the environment. And this fortunately leads to a number of job opportunities in the field, including there's a lot of entrepreneurial initiatives, people starting their own companies, revolved around things like security of the health data, different ways to motivate individuals to improve their own health. There are also job opportunities in health IT implementation. Hospitals are still looking for qualified professionals to help them bring in these new electronic health record systems, to train their employees on best practices for utilizing these systems. There's interest in legal firms in understanding a lot of the implementations of some of the laws that have been passed and understanding whether or not the laws are being met. There are job opportunities in health IT development and secondary use of the data that's being collected, medical devices. As you can tell, a lot of our faculty work at the local, state, and federal government level, and there are many job opportunities in those areas, including positions as analysts, positions as data managers, as data miners, and there are also job opportunities in business process intelligence. So why UMBC? UMBC is uniquely positioned to provide education and training that responds to the state and national need for qualified technical professionals in the field of healthcare. Employers in the Baltimore, DC, and Northern Virginia region have exhibited greater growth in health informatics and health information technology positions than other career fields. And the region experienced a 44% increase in the total number of health informatics and health information technology positions from 2007 to 2012, which was the most recent data that I could find available. UMBC is geared towards working professionals. The Health IT program is sensitive to working professionals' need to balance their work life. We do this through offering evening courses, through hybrid courses, and through online courses. So you can really adjust your schedule from on a semester to semester basis, and you can adjust in collaboration with other things that you have that are important to you in your life. And UMBC's Department of Information Systems has a long tradition, history, and success in health IT and in pursuing health IT funded research. So the MPS degree, it's a Master's in Professional Studies. Typically it's aimed at current professionals, not necessarily entry-level, recent graduates, or career changers, but we are open to these types of applicants, and you can certainly feel free to reach out to me or reach out to our graduate program coordinator to ask about, kind of your background, your interest level, and what you bring to the table. I think one of the great things about our program is that we really take an interdisciplinary approach, and we encompass both discipline soft skill development that's needed to function effectively in the workplace and technical development. I think the most important thing that I look for in potential students is a willingness and ability to learn and to learn in different areas. So even if you're not going to go out and be a computer programmer, I think that it's important to take a computer programming course, and we do offer those here, just so that when you communicate with the people at your company that do that type of work, you're able to communicate and translate the needs effectively. We do not require a formal master's thesis, but we do have a capstone project where you can tie in a master's type thesis if you're interested in specializing in a specific research area. And as I said, we also have on-campus and online courses available. So who should consider health IT? This is a really extensive list, and it's truncated. It doesn't include everyone. I would say where you end up in the health IT field is really a demonstration of your personal motivation combined with your background and what you bring to the table. People that have been successful in health IT are those that come from a health policy background, clinicians, including physicians, nurses, physician's assistants. We have a physical therapist in the program, electronic health record implementers, customizers, and educators, information systems professionals, IT professionals, researchers, kind of people that have a strong science background, systems analysts who want to subspecialize in health. A lot of the bigger industry employers, such as Lockheed Martin and Northrop Grumman, are looking for systems analysts that have this subspecialization in health as they look to transition and broaden their footprint in this market. Executives, leaders, and managers of hospitals or healthcare centers who want to have a robust understanding of the health IT operational environment, inspiring health IT entrepreneurs, and most importantly, really the people that should consider health IT are those that are passionate and dedicated to improving both public and human health. So in the program, we have 6 required core courses. Health Informatics 1 and 2 will provide you with a breadth of the health informatics field and help you to identify the areas of health IT that really might be of interest to you personally. Are you interested in improving public health? Are you interested in public policy? Are you interested in data mining and data visualization, cloud computing? All those things will be presented in a really broad way in the Health Informatics 1 and 2 courses. And that way, later looking to choose your electives, you can base your elective choice off of what you learned in these 2 courses. We have Health Data Analytics, where you'll get to learn more about the R program. You'll get to go through health data visualization projects and really how to analyze actual health databases. We have health IT policy and administration, law and ethics, which will go through things such as HIPAA, the importance of privacy, security, and really look at the health IT law landscape, both at a national and local level. And then the last required core course is our capstone project. And I really look at this as a way for students to really focus and hone in on, the skill set that they want to walk out of the program with for their, either for transitioning into a new career field or for looking to move forward at a faster trajectory in their current employment. We also have a number of electives which are listed on our website, but they do include things such as health informatics, entrepreneurship, public health informatics, precision medicine, cloud computing, and telemedicine. There's really a number of electives that we have available. And so as far as the student experience, again, our courses are taught by current practitioners who draw on current real-world situations that they know from their day-to-day work, and they utilize these experiences to provide an interdisciplinary approach to learning. There's flexible scheduling and elective courses. Our courses are a combination of seminars, group projects, and again, we also have hybrid and online courses available. 2 electives may be taken from other departments such as information systems or engineering management for the students that are interested in going into like health IT project management. We do individual development plans and midterm evaluations to keep our students on track and to fully support them reaching their personal career goals. We have a great small class size. On average, our classes are 12 students, and this allows both me as the graduate program director, but also our faculty members to provide individual career counseling and mentorship. And then the students are encouraged, as their schedules permit, to participate in UMBC's health IT research, both external health IT internships and external volunteer opportunities in different health IT companies. And they're also always welcome to attend various guest lectures that we have in the department. So now to get into a little bit more of the nitty-gritties of the program as far as policies and designations. You need to be enrolled 9 credits to be considered full-time as a graduate student here. That's the equivalent of 3 courses a semester. Of course, many of our students choose to complete the program on a part-time basis. We require continuous registration or leave of absence is allowed with advisor approval. And that just means that you should be enrolled each semester in the academic year, fall and spring, with summer being optional. As far as the graduate school level, the academic standards, you're required to maintain a cumulative GPA of 3.0 during your course of study. This really hasn't been a problem for any of our current students, and I don't anticipate it being a problem in the future. We do allow transfer credit. The UMBC Graduate School will allow a maximum of 6 graduate credits, which in our program is the equivalent of 2 courses, with consent of the program director. And again, this is if there's an equivalency for that course within our program. And so if you're interested in joining us for the fall, I encourage you to apply. You can review the admissions requirements on the website that will be available at the end of this webinar, and also just right here at umbc.edu/grad school. We encourage you to submit all the required materials. For domestic students, this requires a copy of your undergraduate transcript, which I understand sometimes can be challenging to obtain depending on if it has to be a written request or if it's available online. The application for fall is due August 1st. We are still admitting international students, but for those students, I highly encourage them to get their application material in as soon as possible. We are doing rolling admissions, and it is important for some of the international visa processing. In general, we look for a minimum undergraduate GPA of 3.0 on a 4.0 scale, but there is some flexibility there based on your work experience, and I do fully look at the students. I know that some people will say, well, my freshman year of college, I struggled a little bit, but you can really see that I was able to pull all my grades up and do a much better job towards the end of graduation, and I take all those things into consideration. And so letters of recommendation are helpful but not required. We look at the experience data form where you can include any relevant work experience. And like I said, the completed application should be done online. And so just to wrap things up with another quote, keep away from people who try to belittle your ambitions. Small people always try to do that, but the really great make you feel that you too can become really great. And what I look for in all of the faculty hires that I do is really looking for faculty that are well trenched in the HIT field, but are also really supportive, great mentors for our students and for our students achieving their career goals. And so I'd be happy to take any questions that might have come in or that attendees would like to submit now.
Thank you, Dr. Harrian. That was great. We did have a few questions that came in during the presentation. So the first question is, how does UMBC's Health IT program compare to other programs in the region?
So I actually, when I was moving back from New York, I was looking for academic training programs in this area, and they really don't exist. I think it was very innovative of UMBC to step out into the health IT area, because from a job market perspective, there's so much demand for professionals that have been trained in this area from local industries such as Lockheed and Northrop, from local government agencies like CMS and FDA. So I really applaud UMBC for stepping into this health IT arena and really taking the lead in this geographic area.
Great, thank you. The second question is, what is the recommended first class out of the core classes?
I would always recommend starting with Health Informatics 1. And then other than that, it'll help provide you with the breadth of the field, and it'll help you later on with your elective selection. But other than that, you can choose to take it with any of the other core courses. And if there are students that specifically have certain concerns about their background or certain passions and are looking for kind of individual recommendations, I'm always happy to give those.
Okay, thank you. Another question that came in, can I take all the courses online?
No, right now you can take approximately, and I can work with you together on this, you can take approximately 40% of the courses online. And we anticipate, including starting in spring, we'll have the Health Informatics 1 available online. In the future, we might look to broaden that out, but I think that it's important to look for programs that do have an in-person component, because that's really where you collaborate with your classmates. It's where you meet really potentially great friends that'll help you throughout your career trajectory. We have students that work at Blue Cross Blue Shield, that work at CMS. They can help you in your future position. And I always reach out to the colleagues and friends that I made in my training programs. So I think that while it's important to have an online component for some added flexibility, I also think it's important for students to participate in some in-person courses.
Great, thank you. Another question that came through, you mentioned that the program is not geared towards recent graduate or career changers. Is there a specific reason as to why this is?
So in general, that has to do more with the history of Division of Professional Studies. So the Health IT Master's Program is located half between Division of Professional Studies and half between the Information Systems Department. And so that's been a long-standing recommendation from Division of Professional Studies. I'm a little bit more flexible with it because I have seen students that come directly from undergrad with like a health administration and public policy background that end up doing exceedingly exceedingly well in the program. And again, for me, a lot of the basis is really, what's the student's motivation, what's their passion? And I think anyone that's really passionate about improving public health, improving the healthcare system, or is passionate about, data analysis and secondary data use and the research components will be successful in this field.
Great, thank you. What are the opportunities for students to complete special projects or independent studies in the program?
So we have the capstone course, which is a one-semester course. So in a way, it's a requirement for each student to complete a special project within the master's program. But in addition to that, we do have some students that are interested in internships, experiences, and we get a lot of inquiries locally from companies that will be, I guess, distributed through the email distribution list for those students that maybe are not employed full-time and do have some daytime flexibility and are looking to get experience with a health IT startup company or with a health IT policy company.
Thank you. Another question that came through, will the program cover EMR standards, predictive medical, data mining, and trends in big data?
Those topics are covered both in our core courses, but also in our electives. So if somebody is really interested in big data, in data mining, they can choose electives to complement that interest.
Great, thank you. And one final question. So if there are any other questions, if you want to go ahead and enter them now, I'm going to ask the final question, then we'll take any additional questions that come through. How long do I have to complete this program?
I would say it's a personal decision, and some students, the way that they are able to schedule their work-life balance is they're only able to take one course a semester, and perhaps they want to do that through fall, summer, spring, and then maybe they have changes in their life and they want to take more than that. So I mean, it's really an individual choice. A student going full-time could complete it in I think it's about 18 months. But our part-time students, again, they just balance the coursework with everything else.
Great, thank you. Those are all the questions that we have. So I'm going to go ahead and close out the session. Dr. Harrion, unless you had anything else you wanted to add?
No, but I mean, honestly, feel free to email me if you have any additional questions. I tend to find with things like this, sometimes things occur to you after you sit back and you have time to digest, and I encourage you all to apply for the program. Take care.
Dr. Harrion, I'm sorry, there's one final question
Okay.
that came in. I want to, how many total classes need to be taken?
It's 10 total. It's 6 core and 4 elective, unless you are able to bring in transfer courses.
Great. Thank you. And if you have any other questions after today, please feel free to email Dr. Harrion directly and she will get back to you. So we thank you for spending your afternoon with us, and we look forward to connecting with you for the fall. Thank you.